A few months into the coronavirus pandemic, a post-COVID condition was discovered in children. News Channel 6's Mary Calkins spoke with a pediatric infectious disease doctor about the disease and what parents should keep an eye out for.
MIS-C, or multisystem inflammation syndrome in children, typically shows up about 2 to 6 weeks after COVID. Kids will experience a prolonged fever and swelling of different organs.
Dr. Jim Wild says MIS-C is often mistaken for Kawasaki disease.
Initially, it looked like they had a rash of Kawasaki disease, which is another childhood disease that we see relatively frequently. It looked very much like Kawasaki's, but it was not. And that's when they realized there was a new entity here that was mimicking Kawasaki's disease.
However, Kawasaki is not COVID-related and strikes kids at a much younger age, while MIS-C affects children in the 5 to 15-year-old age range who have tested positive for COVID. MIS-C causes inflammation in organs such as the heart, lungs, eyes, skin, and brain.
This is a really, really sick child that you're looking at. In fact, the CDC definition requires that the child is sick enough to be admitted to the hospital before you can even make the diagnosis. Kids who just have a fever and a runny nose and cough and are not that sick would not meet the case definition for MIS-C.
The World Health Organization says to meet the criteria, a child must have 3 or more days of high fever and symptoms like altered state of mind, shock, kidney problems, or skin rash.
One of the critical criteria is you have to have at least some evidence that you've had a COVID infection in the last 2 to 4 weeks. If there's no evidence for a COVID infection in the last 2 to 4 weeks, we're not even looking in the direction of MIS-C.
Dr. Wild says MIS-C is rare and most kids typically make a full recovery after being treated.
MIS-C, first of all, is relatively rare. COVID itself is not usually real severe in children. The number of children that get MIS-C after COVID infection is really small. And the number of children who have MIS-C and have a bad outcome is extremely small. So this is not a major alarm for parents.
In Augusta, Mary Calkins, WJBF News Channel 6.